Addicted to the sweet stuff. We're all eating more sugar and our sweet tooths are causing a worldwide health crisis. So how are food and drink manufacturers trying to keep us sweet? What should we be doing about it? This is Inside Story. Hello and welcome to the show. I'm Sami Zaidan. Sugar heaped into just about everything we eat, all washed down with sugary drinks. Well, health experts are warning we're eating more and more of the sweet stuff and our addiction is killing us. Heart disease, obesity and diabetes are all blamed on our sweet tooth. Well, the crisis is most acute in the US, the UK, Australia and Latin America. But much of the developing world is at risk too, because sugar consumption is rising more rapidly there than anywhere else. Our reporter Carolyn Malone helps set up today's discussion.
Soft drinks, sweets and packaged desserts, all obvious sources of sugar. But how about tinned vegetables and savoury sauces? Did you know that some brands of tomato sauce for pasta have the equivalent of 30 grams of sugar, about the same as in a Mars bar? Health researchers in a new Lancet report say that 74% of packaged food and drinks in the US have added sweeteners.
The added sugars into our whole food supply is really one kind of a pernicious, kind of negative, adverse way that the global food companies are hurting our health. The sugar in our food supply is very subtle. They use hundreds of different names for it and we're not aware of it.
Glucose syrup, nectar or whatever it's called, the World Health Organization says we should be eating less of it. It updated its guidelines this year to recommend people cap their sugar intake to 5% of their diets, not including sugars naturally found in fruit, vegetables or milk. But the reality is people consume far more sugar than that, particularly in sweetened beverages, such as sports drinks, fruit juice and flavoured water. The highest consumption of sugary drinks in terms of calories a day or volume sold per person is in North and Latin America, Australasia and Western Europe.
Governments don't take this issue on board, which is certainly happening in lots of regions of the world. We're going to keep seeing this large, rapid increase in diabetes, hypertension, cardiovascular death, and subsequently in a number of cancers. 13 of the top 16 cancers are related to abdominal obesity or obesity, and the World Cancer Research Federation also listed this as one of their top 10 prevention actions. Actually, number 2 after tobacco, cutting soft drinks and sugary beverages out of our diet.
The Lancet authors say that introducing a sugar tax of 20% or more can have a noticeable effect on decreasing consumption of sugary drinks, particularly in children and adolescents. And that's already having a positive effect in places like Finland, France, Hungary and Mexico.
So lots to discuss. Let's bring our guests straight in. We have here joining us in the studio Dina Labiskachny, a dietitian and nutritionist at Evolve. In London, Bryony Sinclair, Senior Policy and Public Affairs Manager at the World Cancer Research Fund International. And joining us via Skype from Cape Town, LEONIE JOUBERT, Specialist on Food Security and author of The Hungry Season, Feeding Southern Africa's Cities. Good to have you with us. If we could start with Bryony then. We've all known for a long time that sugar is not the healthiest ingredient, shall I say, in our diet. What's new in this Lancet report? Why should viewers be concerned today more than yesterday?
Right, so we know that there are adverse health effects to consuming too much sugar, and this recent paper by Barry Popkin and Corinna Hawkes does an analysis of trends of sugar-sweetened beverage consumption. And what we're seeing is that there are 4 regions with extremely high consumption of sugar-sweetened beverages, but then we're also seeing that in low and middle income countries, consumption is rising. What is great about the paper is that it also looks at not just the trends, but that it looks at what the policy responses are that can effectively reduce sugar intakes. And what we're seeing is that countries that have implemented taxes are, based on this trends data, are starting to see decreases in consumption levels.
Okay, that's interesting. And we'll get to perhaps the policy implications and what can be done about it in a moment. But I want to turn to Dina here in the studio and say, first of all, why? Let's take a step back. It sounds like from the researchers that sugar is being hidden. It's being smuggled into our diet. Is that what's happening?
Yeah, I think there's so many people look for sugar when they're buying a product. So they look at the label and they think they're only looking at sugar. But in reality is most of the manufacturers are actually now disguising sugar in different names. So a main thing that actually came out was the high fructose corn syrup. It was very much cheaper, so it was included in a lot of the foods without actually having to increase the sales of the food or the prices of the food. And a lot of people didn't look for high fructose corn syrup because they were looking for sugar. So if a consumer goes and reads a label, they were actually looking at sugar and saying, oh, this food doesn't have sugar in it.
This is sugar-free. I'm
Yes.
safe. I can buy it, but it's not. Well, why is that happening?
I think it's also from the manufacturer's side it's a way to, because sugar became such a, sugar is the addiction and sugar is bad for you, and consumers actually became aware of that they needed to start reading the labels. So I think from a consumer side it was a cheaper alternative to your sugars, and it's also a way to actually disguise it to continue with the sales. I'm not 100% sure if that was the initial response, but that is how the consumer are seeing it. They are seeing it as sugar is being disguised.
Leonie and Keitan, it almost sounds as if there's an assumption here that we as human beings won't eat products unless they have sugar in it.
Well, there certainly is an addictive nature to sugar. It stimulates the same pleasure center in your brain as cocaine does and as sex does. But interestingly enough, as you get exposed to sugar over a long period of time, your palate becomes numb to it. So in order to get the same kick out of it, you end up adding more and more and more. So really you get conditioned to it. And, you know, a tiny bit of sugar once in a while isn't an issue, but if you are exposed to sugar over many, many years, the implications are very serious for your health. And, you know, people are often saying these days that sugar is the new tobacco. The difference, though, between tobacco and sugar is that children are exposed to sugar right from when they're infants. From when they're weaned, they're often weaned onto a highly sugary diet. And that means that their exposure to this very addictive food starts from when they're infants, and it carries on through a time of their life when they're incredibly vulnerable. If you look at how the brain develops, a child and adolescent brain is still incredibly impulse-driven right up until they reach the age of 25, which means they are learning this very addictive behavior from when they're young. And it makes it incredibly difficult to change that addictive behavior, that learned behavior later in life. Mm-hmm. And then, of course, you see the public health crisis associated with years and years and years of exposure to this substance.
But, Leonie, I guess my question is, why aren't health authorities controlling this? Those authorities which are supposed to be supervising the food industry, I mean, where are they?
I think there are a lot of comparisons between big food, between cigarettes, and between oil. I think the private sector has a massive lobbying power. If you compare what happened with tobacco, there was a very long lead time between when the science said conclusively that long-term exposure to tobacco had these serious health implications, and then, of course, years and years later, only then did the policy come in. And I think we need to see similar policy, particularly protecting our children. But I do think there's a massive lag, and part of that could be because many of the multinational corporations who are selling these foods have incredible lobbying power.
All right. Perhaps we should point out that we did actually we tried to invite several representatives from organisations that represent associations of food manufacturers onto the show. We were unable to secure anybody's presence here. Obviously, they are an important part of the discussion. What is an important part of the discussion too is the link, I understand, between the move towards industrialisation, Briani, and the move towards what we sometimes call modernisation and urbanisation, and the increase in consumption of foods which are very low in nutrients, high in things like sugar and fat, right, Briani? Yes,
so we are seeing an increase as cultures are sort of adopting a more westernized diet that are higher in fat, sugar, and salt, and higher in processed foods as well. Because, as was mentioned, a lot of food that we find in sugars are added by the manufacturer or the retailer, and are in foods that you wouldn't necessarily expect. Of course, it's in confectionery and sugary drinks, but it's also in sauces and low-fat yogurts, ready meals. And so the more that countries are adopting more of this Western diet, the more these types of foods with the higher amounts of sugar are being incorporated into their diets.
All right, I just want to pause for a second and take a look at how sugar consumption actually affects people's health right around the world, including in the United States, as Rob Reynolds now explains from Los Angeles.
Here in the United States, the good news is the number of new cases of diabetes has begun to fall after decades of rising rapidly. The U.S. Food and Drug Administration has, for the first time this week, called for a cap on the total amount of sugar consumed on a daily basis. The bad news is that diseases like obesity and diabetes that are closely linked to sugar consumption are still much more prevalent among poor Americans, Latinos, African Americans, and Native Americans. And that tends to be the case worldwide. Poorer people tend to suffer more from excessive sugar in the diet.
Dina, on that point, poorer people suffer more. Why? Well, what do you say to those who say, I simply don't have the budget to live that lifestyle of natural, healthy food? Organic is more expensive. There's no alternative, is there?
Well, I actually come from a background from South Africa where it's actually seen as a little bit of the people suffer a little bit more under the economy. So you actually need to tell them alternative, healthier options. And solutions for that is just your healthy fruit and vegetables and things like eggs, which is naturally a little bit cheaper than some of your other alternatives, or things like beans and legumes. And things that you don't really have to go over to the processed side of things, but you can still keep it to the natural side without having to pay extreme amounts of money to buy it. Whereas with the sauces and the things that people start consuming a little bit more is actually where the money continuously going into. So I try and really bring them back to some of the natural uses, and some of the things, like I said, like beans and legumes, where they can actually get loads of protein value in, which is a little bit of cheaper alternatives.
But even some of that stuff that requires cooking, that requires time, right? And can that always compete, whether it's in terms of time consumption or even money, with the fast food joint next door that will sell you what looks like a copious amount of food for a very small price?
Yeah, that's the problem that we're finding, is that people tend to go for the cheaper, and most of the cheapest ones, like you're saying, is the fast food restaurants. It's not other restaurants where you can buy something healthier. So for that is we really do advise people to actually start looking at making their things at home, trying to get that little bit of time to actually try and make healthier solutions, not going to the fast food, because it's actually going to cost you more time in the future having to treat your diseases, having to treat the lifestyle condition coming from the consumption of worse foods. So we need to look at not only the picture now, but at the long run. How is it going to affect my health, and how many time will I have to spend in my health in the future?
How much money will you have to spend on medication?
Exactly.
In the long run.
So just by now adapting your lifestyle and your diet now where you're at, without having to undergo.
Leonie, are corporations, are some multinationals now deliberately targeting the developing world, as well as perhaps the more vulnerable in the developed world, as a sort of new front line for marketing their products which are not very healthy, just loads of sugar and fat?
Very much so, and not just fat. I think the highly refined carbohydrates need to almost be lumped in the same category as sugar, because the response to the body is very similar. But you know, it's interesting looking at how many of these multinational fast food corporations have come into Africa, Southern Africa, using South Africa as a springboard, where many of them had a strong presence, and admit even in their marketing campaigns that they are targeting this new market because they feel as though the market has reached a ceiling in many of the developed world countries. The other thing that really comes through in a lot of the research that I've done is the incredible power of marketing and advertising, which these large multinationals bring with them. And of course, the lobbying influence that comes with that. You know, to revert to the Lancet once again, who you were referencing earlier in this show, in 2011, the Lancet brought out a special report on obesity, and they made a very clear link between the public health crisis we're talking about now, which is linked with this nutritional transition you mentioned, which is the switch to this highly processed industrialized diet, The link is between the marketing by these companies and poor communities' desire to eat these foods. So these foods are seen as highly desirable, they have a high status value, and the marketing by these companies was described by the Lancet using the following words. It was, the marketing is seen as pervasive, persuasive, and predatory. And that's very strong language for a medical journal to use. Yes. We had a case in South Africa a while ago where a large fast food chain opened its first outlet in Cape Town. The queues went around several blocks as people queued for up to 2-3 hours to get their first burger. This is an indication of the status value that some of these foods have. And similarly, you know, when some of these corporations have greater buying power than nation states, for instance, Walmart makes the annual revenue of a company like Walmart, which sells a lot of these foods, that annual revenue is greater than the GDP of South Africa. So if you think about, you know, how our government manages its own policies, for instance, if it's being lobbied by a corporation that has greater buying power than it does, you can see that there's an imbalance in power here.
Wow, that's a scary thought. That must also be leading, Bryony, to quite an unusual strain on national budgets for countries which are dealing, on the one hand, they're still trying to fight malnutrition, but now they've got also all these non-communicable diseases, such as obesity and diabetes, from bad nutrition at the same time.
Yeah, so malnutrition in all its forms, so encompassing stunting, wasting, micronutrient deficiencies, and overweight and obesity is an issue in many countries around the world, which is why a comprehensive policy response is needed in order to help address all forms of malnutrition, which does include overweight and obesity, because we're often seeing that sometimes even in the same household there are the sort of undernutrition as well as overweight and obesity.
So, Bryony, why isn't it being addressed then? Is it what Leonie seemed to be hinting at there, that perhaps national governments are feeling a little overwhelmed by large corporations?
Well, it is an overwhelming issue. The obesity crisis is affecting every country in the world. There's no country in the world that is seeing a decline in adult obesity rates. And as we know, obesity is something that's incredibly complex. There are a number of different factors that influence that are influencing overweight and obesity, which is why a very comprehensive approach is necessary in order to start addressing it and help reducing obesity. And one of those is looking at sugar. Sugar is only one component of an unhealthy diet, and it's important that we not focus on sugar in isolation, but within the context of other dietary components. But because we're talking about sugar today, the amount of sugar that we consume is determined by how available it is, how affordable it is, how acceptable the alternatives to sugary products are, and also how aware we are of sugar in products. So World Cancer Research Fund International created a policy framework that is called Nourishing, and each of the letters within Nourishing identifies a different policy area that is needed in order to promote healthy diets, and also to, within this context, to reduce sugar, reduce sugar consumption. All
right, talking about how available it is, how affordable it is, those are some of the themes that Scott Heidler has been looking at, and has been looking at the eating consumption patterns of people in Thailand.
Thailand is the world's second largest exporter of sugar, but it's also a big consumer. Sugar has been a mainstay of Thai cuisine for centuries, like these sweets, but it's also served as a condiment during savory mealtime. With the introduction of sugary drinks and processed food, that intake of sugar has increased even more. The average Thai consumes 104 grams of sugar each day. That's 4 times the amount that's recommended by the World Health Organization. In fact, Thailand has the second highest obesity rate in Southeast Asia. It has also seen a spike in cases of diabetes. The government is going to go after top offender number 1, saying that they're going to start to limit advertisements and promotions of sugary drinks.
There's an interesting question here, Dina, about how you tackle that. Do you put taxes on foods which are high in sugar and not very healthy ingredients, or do you rather shift the responsibility back to government, say you should simply regulate the amount of sugar you can have in 100 grams of food?
I think actually it comes to both sides. I think we can't just blame it on one or the other side. I think it's important that there is taxes on the sugary, because we need to start cutting it off from the manufacturers to say the amount of sugar that you're actually putting in food, it must still be seen as not causing conditions like diabetes or heart diseases. So they need to be looked at, that we can see we can't put in just the amount of sugar we want, because
should be regulated as other substances are regulated.
I definitely think we need to regulate that, but also we need to look at labels and just maybe adjusting the label so that the consumer can also know what is actually in my food. If you go and pick up a food, how much sugar is in there, what is my daily values of sugar needs to be, so that we can actually teach the consumer as well, if you are making that choice, you need to make the right choice for your own health also. So it needs to be coming that the labels that's going out to the consumer needs to be the proper labels, and also the...
Sounds like a bit of education as well thrown in the mix there. We need to understand better, you know, what exactly we're eating, what we need and what we don't need.
That's the thing. In the end, each person's health is also their responsibility, and I think there is a lot of responsibility laying at the manufacturers, which is also true, but we need to, as consumers, also be aware of what we're actually putting into our bodies.
Leonie, when you start to dig deep into this, Leonie, it gets a bit scary. I mean, just look at the points that we've raised in the last 20 minutes. We're talking about changing patterns of industrialization, urbanization, re-educating people, corporate regulation, perhaps legislative changes. I mean, is there any government or person or quarter or agency in the world that can take on all of that? It's a very big challenge.
It is a huge challenge, and I think there's a big gap there. I think you've identified the gap. You know, one of the reasons we have such a lag and a lethargy from a policy perspective is there's this pervasive myth that this public health crisis is the individual's fault. You ate badly, you didn't exercise properly, you got yourself fat and sick, and you must now fix yourself. And certainly in Southern Africa, the focus, therefore, is on educating people in the hope that they will then change their behavior. And this is allowing all sorts of other gaps to not be filled. We definitely do need maybe some kind of international response to urge governments to put in both market-related mechanisms, such as a sin tax, that then cross-subsidizes so that these healthier, more perishable and more risky foods from a business perspective become cheaper and more available. The other thing is that, you know, this isn't just about the individual, and it's not just about this industrial food system. There are things like the geography of the city, market mechanisms that lead to food deserts in cities. These are all things that drive people in the wrong direction. Again, to quote the Lancet, they had a fantastic quote a few years ago where they said, this rising obesity is the normal response of normal people to a very abnormal environment. So we need to try and understand what it is about this environment that is so abnormal. And it requires a very intelligent, high-level view of what that is.
Bryony, it seems that of all countries in the world, it's the developing countries which are the most vulnerable to the trend that's going on. If changes are not made, because these countries, of course, they already struggle when it comes to their education systems, their healthcare systems. If the food industry doesn't change, and if people are not allowed to eat more healthy foods with less sugar and more nutritious ingredients, what sort of scenario are we looking at for the developing world?
Well, we will be looking at an increasingly dire picture, looking at poorer health outcomes. World Cancer Research Fund International's Continuous Update project shows that being overweight or obese increases the risk of at least 10 cancers, and being overweight or obese is a risk factor for a number of other non-communicable diseases as well. And already non-communicable diseases are the #1 killer worldwide, and that is in both developed and developing countries. So we will likely to see a continued increase in non-communicable diseases.
We'll have to leave it there, I'm afraid, because we are out of time. Let's thank our guests, Bryony, Leonie and Dina here in the studio. And thank you for watching. As always, you can leave your comments on the programme's page of our website, aljazeera.com, and you can post your views on facebook.com/AJ Inside Story, or tweet us at AJ Inside Story. From me, Sami Zaidan, and all the team here, for now is goodbye.